Hello, and welcome to Your Health Matters. My name is Dr. Peter Hogenkamp, and today in the program, we are going to be discussing and answering the question, why am I so sad? You may remember that last month we answered the question, why am I so tired? And today we're going to answer the question, why am I so sad? This all stemmed from one day I was sitting home at night and I didn't have enough to do. And I Googled common medical questions, and I was amazed to see how many hits there were on why am I so tired? Why am I so sad? These are very common issues among people, and they seek the internet for answers. And so I thought today we would answer the second most commonly asked question to Google, and that is, why am I so sad? To start off with, I wanted to talk about the difference between sadness and depression, because they are different. Sadness is oftentimes a part of depression, but just because you are sad, or even persistently sad, does not mean that you're depressed. So what is sadness? Sadness is a basic human emotion, and it's a reaction to a situation that causes sadness. For instance, if your dog of the last 14 years died, I would expect you to be sad. I want you to be sad in that circumstance. That's a normal reaction to a painful stimulus. That's what sadness is. If your father dies, I remember I've always been a chipper guy, and when my dad died, it was tough for me. He was very close to me. He died relatively young. He just moved back to Vermont, and I was so enjoying spending time with him. And then he got cancer and died, and I was sad about it. I was sad before he died. His illness made me sad. His death made me sad. The sadness that stems from death of a loved one is called grief. It's a very, very normal process. Just because you're grieving does not mean you have depression. If you wanted to go to a party and all of a sudden you got sick and couldn't go, if you wanted to had your heart set on going to a certain college and you can't go, you're sad about those things. That's a normal reaction. That is not sadness. So keep that in mind. In fact, the ability, or some people are unable to be sad. We call these people alexithymics, and these folks they're not happy people. Just because you can't experience sadness, their inability to have normal human emotions actually makes it very difficult to relate to other people. They tend to be very lonely. So sadness is a part of life. Some people say, and I certainly agree, that you can't be truly happy unless you've experienced sadness. So if you're sad, keep in mind, why is it that you're sad? And also keep in mind that the sadness that you're experiencing also allows you to be happy in your life at other points in time. So, when is sadness more than just sadness? When does it mean depression? And I always tell people that the way I look at this is, if your persistent sadness is causing your to function poorly, then we may want to consider that you're depressed. What do I mean by that? Is your sadness affecting your relationships? Is it affecting your job or school performance? Is it affecting your physical health? If those things are true, then it's very likely that you actually have depression. Here's an example of this. People come in to me all the time and say, geez, Doc, it's not feeling good, I'm down. By the way, very few people use the word sad. And in fact, when people are truly depressed, oftentimes they don't tell you they are sad. They will specifically deny it. But let's say I'm trying to determine if a person who does come in with sadness, if I'm trying to determine if they're depressed, and they say to me, geez, it's really getting in the way of my relationship with my wife. We're arguing all the time, or we're not getting along, we're not talking, we're on the verge of a divorce. So that's a positive indicator that you might be depressed because it's affecting your relationships. Another question I ask, well, how are things going at work? If somebody says they're sad, but work's great, that tells me that it's possible or even probable that they're not depressed. On the other hand, if they say, geez, I'm on the verge of getting fired, I got a couple terrible evaluations, I got demoted, well, we may be looking at depression. Physical health, and this is where I think the money is. I ask people about their physical health. Are you eating? People who are depressed oftentimes will have difficulty eating, or they'll eat too much. Sleep. Sleep function is intimately tied into into depressive states. People that who are depressed, especially who experience some kind of episode of major depression, they're going to have some type of sleep dysfunction, whether that be they can't sleep or they sleep all the time. Their weight is affected. You'll see people with major depression oftentimes lose significant amounts of weight. A lot of times because they just simply don't have they don't have any appetite, or they just don't have the energy. They don't have the ability to get out of bed and make themselves food. So that's always worrisome when some people comes in, geez, I've lost 20 pounds. Your psychomotor health. People who are depressed, oftentimes, they're, I don't know if you're familiar with the word catatonia, but it basically means a person with catatonic, they have so much difficulty moving, they can't even really change the expression on their face. And that does happen. It's not common, but I've seen it 3 or 4 times in my career. Or they're tapping around like this kind of thing, and so they're agitated. You can see that they've got psychomotor agitation as opposed to psychomotor depression. Of note, just because somebody has psychomotor agitation, that does not mean they're depressed. I don't feel that I'm depressed and I'm always moving around because I have another issue that causes that. And that just goes to show you how these things are, they're nuanced. It's oftentimes hard to diagnose things because different problems cause the same symptoms. The last thing I would say about depression is that depression causes a decrease in libido. So libido would be your sex drive. And people that come in who are sad, but they have a very healthy libido, I'm here to tell you that there's almost no way that person is depressed. Libido or sex drive is the first thing to go when you're depressed, and it's the last thing to come back. So these are some of the ways, and I hope that's helpful for you, these are some of the ways we differentiate between depression and sadness. If you are depressed, if what I have told you makes you think that you are depressed, if you have some of these indicators of depression, not just sadness, go see a mental health professional or a healthcare provider. Get help. Because there's a lot of excellent help for these. There are medications that we use, there is counseling, there's all kinds of programs for people. There's a lot of things that we can do for depression. Go seek help. If you are just sad, if what I'm telling you thinks, hey, maybe Doc's right, maybe I'm not depressed, maybe I just got sadness. Again, sadness, even if it's persistent, does not necessarily mean that you're depression. So if you have sadness, we want to know why you are sad. Because finding out why you are sad is the first step towards fixing why you're sad and making you happy. And that's what the whole idea here of our program is today. So the first reason people are sad, as I mentioned before, it's a normal reaction to a painful or upsetting stimulus. So I mentioned before, your dog died, you're sad, that's normal. My wife always tells the story that when she was a kid, her best friend moved across the country and because her dad got transferred. And she spent all this time with this young lady, this 6th or 7th grade, a time where girls get really close, and all of a sudden this girl that she spent all this time with is now moved across the country. And all of a sudden she's sad. That's a very, very normal reaction to that. So the number one cause of sadness is just a normal reaction to painful stimulus. So what do you do about it if that's the case? I tell people that if I'm sad, I tend to watch something funny. In my case, my go-to funny is Seinfeld. Thank God for Netflix. You can get on to Seinfeld and watch any show. And if George Costanza doesn't make you laugh, I'm not sure what's going to. Arrested Development is a great show. Curb Your Enthusiasm. These are great comedies. I'm sure you've got some of your own. Go watch a couple of comedies. Laugh. It's great for you. Take a walk. I've said this a million times before in the course of my 30-year career, as well as during this program, or anytime I give a talk about medical, medical matters. I always tell people walking works for everything except osteoarthritis. It doesn't really do a lot for the knees, or actually it does, but it'll also wear them down as well. Go take a walk. Get the fresh air, the exercise. It's wonderful for you. Make a phone call. Make a phone call. Call your mom, call your dad. As a parent, I want you to call us first. Call your brother or sister, call your friend. Call someone you haven't talked to in a while. One of the things I love to do, especially if I'm, it's just down, like I just look through my contacts and I haven't talked to Paul Costello in ages. And I call up Paul Costello and he makes me feel better. Journal. I'm a writer, and I believe in the therapy of writing. That's probably why I write, because it feels great. It's obviously a creative exercise as well, but it's also great for you. It's great for your mood. So these are some of the things that you can do when your sadness is from a normal stimulus of an upsetting situation. The second thing, and I want to talk about this briefly, I don't want to spend a lot of time about it, is a neurochemical imbalance. We talk about this all the time, that certainly there's a lot of truth to depression being, at least in part, a neurochemical imbalance. We talk about dopamine, we talk about serotonin all the time. I learned about all kinds of neurotransmitters in medical school, and I'm not going to bore you with it. But there's a certain amount of truth to sadness and depression being a neurochemical imbalance. But it is not your neurochemical destiny to be sad. You are not born to be sad. And that's important, because I want to talk today about choosing to be happy. I want to talk about the choices that we make that make a sadness more likely, and the choices that we make that make happiness more likely. You can't choose to be happy all the time, because life is going to throw bad stuff at you. That's just life in this world that we live. But you can make the amount of time that you're happy a lot higher if you make better choices. And that's what I'm hoping to help you with today in this program. Choose to be happy. Do not choose to be sad. So, let's talk about the choices then that you can make to be happy. The first thing I want to talk about is sleep. Sleep. Americans just don't get enough sleep. I suspect that's true around the world, but I know it's true in America, because I was just kind of looking this up for this television show. And sleep, believe it or not, can be a choice. The first reason people don't get enough sleep is that they just don't go to bed early enough, especially given their wake-up time. So I want you to choose to make sleep a priority in your life. You will be happier. There's no doubt when you look at medical studies that the amount of sleep you get corresponds with how happy you are. If we look at happiness as the opposite of sadness, then we can say you'll have less sadness if you sleep more. Now, there are other causes for sleep issues, and we've talked about them before. Next month, I have the great fortune to announce that Dr. Veronica Jedlowski, the sleep medicine specialist at the Rutland Hospital, is going to be joining us for a sleep show. And I hope you'll tune in. That's going to be next time, because Veronica's great. And I think there's a lot of questions that you have about sleep that you want answered. We'll save all the rest of sleep till next program, other than to say you do choose how much time you sleep. And I would say turn off the TV way earlier than you have it on, and choose to make sleep a priority. Number two, and I just alluded to it, about turning off the TV, screen time. It turns out that screen time is bad for you. And it's especially bad for the developing brain, but it is bad for all of us. It's especially bad for our happiness. It's amazing to me because we continue to get more and more involved in this love affair that we all have with our cell phones. But it's not doing anything for your quality of life or your happiness. The more that we look at this, the more data that accumulates, it becomes increasingly obvious to me and to medical health professionals, and I think just to everybody, how bad our cell phones are for us. That said, we're more involved with them every decade. So here again, we're choosing to do something that is not leading to happiness. I think it's going to take something like the Surgeon General coming out in 1964 and saying that cigarette smoking causes cancer. I think it's going to take something like that for us to kind of divorce ourselves from this love affair that we have for our phones. But I really try to use my phone for its intended purposes and not just every second that I've got free look at my phone. And I would encourage you to do that as well. So, a couple interesting facts about screen time. Number one is these screens are stimulating. So if you're looking at your phone late at night, it's going to interfere with your sleep. And I already told you that the less sleep you have, the sadder you're going to be. So that's one easy way to get rid of it. The other thing is how prevalent social media is on screens. And social media is not doing anything for your happiness. I'm going to reiterate that. Social media is not making you happy. In fact, there are excellent studies that show, especially when used too much, social media is a clear cause of sadness, unhappiness. Keep in mind that when you're looking at your cell phone and seeing all these other people on vacation, I don't post at work saying, "Hey, just saw another person with back pain," because nobody wants to hear it. And yet, that's a reality of my life as a primary care physician. I see a lot of people with back pain. I see a lot of people with hypertension. I see a lot of people with diabetes. So you don't post about those things because you don't feel like, hey, people aren't going to click on this. But when you're in Turks and Caicos enjoying a painkiller on the beach, hey, I'm going to send this out, and that's how we operate. That's what happens. I'd like to say that I look at Facebook, which I probably do a couple times a week, and see a friend of mine on vacation, and I can enjoy myself vicariously through them without feeling sad that I'm not there, kind of thing. But who knows? Maybe I'm not being honest with myself. And there are definitely people who get on there and they get this FOMO. And I'm using that expression because I just learned what it was. FOMO, for those of you like me who until yesterday didn't know what that meant, that's fear of missing out. And I think that's one of the big reasons that screen time and social media specifically leads to sadness. You're here, you're at work, or you're shoveling your driveway, you're driving your kids to their dance lesson. It was just not all that exciting, I can tell you, from having done it for years and years, where somebody else is sailing in the Caribbean, and the comparison makes you sad. I think that's fairly easy to see. That said, every year that goes by, we are more in love with our cell phones, despite all this gathering evidence. So, again, I'm waiting for the catastrophic announcement from the Surgeon General saying that cell phones cause some type of horrible problem, and I'm waiting to see what happens in that circumstance. Are 90% of people still going to say, "Oh, I don't really care. I'm just going to continue to use my cell phone"? I really hope not. I want to move along to nutrition. I've said before, I love saying it again, we are what we eat. And the one lesson I want you to learn about nutrition and sadness is that if you want to be sad, eat a lot of sugar. Because, going back to my graph, I love my graph, my little air graph I'm going to make. If we take a look at the amount of sugar that we have in our diet, and we follow that along with time on this axis, our sugar levels go up, our insulin levels go up after those, And as the insulin levels go up and deposit the sugar into our cells, our sugar levels crash. And when we have crashing sugar levels, crashing glucose in our body, it causes us to be unhappy. It causes us, the stimuli, the way we perceive that in our body is unhappiness or tiredness or fatigue or depression, however you want to say that. But it is not a pleasant stimuli. The opposite of pleasantness is sadness, so let's look at it that way. So eating sugar, because the sugar levels go up, the insulin levels go up, and therefore our sugar levels crash down. And that's not a stimuli that we enjoy. So there's a lot to be said about diet and sadness. I'm not going to kind of go into it here because I've got other stuff I want to make in the 8 minutes that we have left. But the first thing you should do if you're experiencing persistent sadness is get rid of sugar in your diet. And when I say sugar, I mean carbohydrate. I said before, I'm going to say it again. Pasta is just a bunch of sugar molecules that are linked together. The same is true for bread or any other complex carbohydrate. Your body, in one simple enzymatic reaction, breaks those bonds, and all that pasta or bread or cereal or potato is another terrible culprit. It simply becomes glucose in your bloodstream. So get rid of carbohydrates in your diet, both simple, meaning sugars, and complex, meaning starches. Okay. Loneliness is a cause of sadness. We are herd animals. Human beings are herd animals. We've been in herds ever since our existence on this earth, and we will continue to do so because that is our nature. We're not meant to be islands. Every once in a while, I see somebody who's persistently by themselves, and it doesn't seem to bother them. That said, their son comes to visit them from Idaho, and they're a lot happier, kind of thing. Don't fool having some alone time is a wonderful, wonderful thing, but having nothing but alone time, that's not good. Loneliness is a cause of unhappiness or sadness. And it's one you can do something about. The classic example of this would be your college kid goes off to college. They're seniors in high school. They've gone through high school. They've made all these friends. They're having a great time. They go to college and they're by themselves again, and they're sad as a consequence. You move to a new city. You're sad. Your best friend moves across the country, like what happened to my wife when she was in grammar school. But we can choose to go out and meet new people, to make new friends. We often don't do it, and sometimes I don't know why that is, but choose not to be lonely. Choose to go out and make new friends. Volunteer. If you think you're lonely, go volunteer and go take the old lady down the street to the grocery store or to the library once a week. Join a club. Loneliness is not loneliness is not. It isn't something that's destiny for you. You can choose not to be lonely. You just have to do it. Substance abuse. There is no doubt in my mind that substance abuse is a far bigger problem in this country than we realize, and we realize it's a huge problem, but it's even bigger than that. I think what happens, people, they get sad and they choose to treat their sadness with alcohol or drugs or screens. Screens can be just as addictive as those other two things. And then they develop another problem. I always tell people, don't create a second problem. You're lonely. Don't treat your loneliness with alcohol. Don't make your best friend Jack Daniels. I use that expression all the time because now you've created two problems. We're going to talk in future programs more about substance abuse. I think it requires its own program or a series of programs. But substance abuse is a choice. Yes. Are people genetically inclined toward substance abuse? They most certainly are. Is it a disease? Is it an illness? Yes. That does not mean there's not volitional element to it. And I mean this, and we have to talk about this because I've heard people say, well, geez, Doc, I'm an alcoholic. I drink. And when I hear that, I want you to realize that in my head, I'm not saying this to you, but that's an excuse. Because you can choose to beat your addiction. You can. You just have to want to do it. So, light is very, very important, especially this time of year. Yesterday afternoon, I happened to have some time off, and I was overjoyed when I got out of the office a little bit early, and the sun was in the sky. And I immediately went home, put on my hiking boots, and I went hiking for 6 miles. And I was ecstatic because we are solar-powered people. The light affects your hypothalamus in such a way that it improves your mood. I get out, I've done this test a lot. I was sitting there on my porch in the shade, and I moved one step over to get in the sun, and all of a sudden my mood improves instantly. It doesn't take hours. It improves instantly. I just did this yesterday in preparation for this talk. I'm sitting there fixing my bird feeder in the shadow, and I have a certain mood. And I said, you know what, I'm going to get in the sun. Well, because also I couldn't see what I was doing. So I got over into the sun, and instantaneously I was happy. That's how fast these chemical transmitters can work. And I'm telling you that the sun causes your hypothalamus to produce neurotransmitters which improve your mood. My first thought about seasonal affective disorder, which is a very, very real and significant thing, is that you need to go outside. Yes, there are bright light therapies, and they work great. They're especially effective for people in Alaska or Scandinavia or Siberia, where there really is no daylight during the winter. But for us, even where I live in Vermont, there's a lot of daylight. You just have to seek to get it. And just because it's cold out does not mean you can't go outside. I've talked about bright light therapies before. They're very effective if for some reason you can't go outside. But I want to talk about stress in the last 3 minutes we have. Too much stress in your life definitely causes you to be sad. However, so many of these situations involve choices that you made. You may not even realize that you made. But for instance, you may have taken a job. You've decided to take a job because it paid more or it had other benefits. But you may hate the job, and the job may cause stress. And I'm telling you, those stressful situations, when chronic, lead to stress hormones being produced and produced and produced. Ultimately, you are changing your neurochemistry for the bad. But you can choose to get out of that situation. I want to give you 2 examples. I saw this patient for years and years and years, and he was unhappy. He was sad. And he knew the cause of his sadness was his job. And I told him year after year after year he needed to get out of it. And he's like, Doc, I don't think you understand. I need the money. I don't really have any choice. And I said, we always have choices. Well, one year he comes in and he's beaming. And I said to him, you changed your job, didn't you? He goes, how did you know? I said, because you just look different. And he did. That was several years ago. He's still in his new job, and he's still happy. School. I had a patient who worked as a physical therapy assistant, and everyone kept on telling him he should be a physical therapist, and he should go back to school and be a physical therapist. So he went on to do this. And he had a very, very difficult time with all the extra studies. And he wasn't the greatest student. He was a great physical therapy assistant, but he really had a difficult time with all the classes. And for years he struggled with this. He was unhappy. He was stressed. He was unhappy. One day he comes in, I saw him, and he's happy, and he goes, Doc, I just bagged it. And I'm doing my physical therapy assistant job. I like it. I'm happy. So he chose to be happy. The last thing I want to talk about is relationships. If you're in a relationship that's causing you stress, whether it be a friendship, an intimate relationship, or even a marriage, if it's gone on for a long time, you may want to choose to get out of that relationship. The most obvious example would be what I call the therapeutic divorce. I had a patient of mine who was unhappy for years, and he came in. I don't think he even realized he was unhappy, although he may have. We didn't specifically talk about it, but he walked in. I can just tell by the shoulders, by the face, by his attitude, his bearing, his posture, he was happier. And I was like, you got divorced, didn't you? And he said, yes. Not that I'm advocating for divorce. I'm advocating for you making decisions that make you less sad. Thanks again. It was great to spend some time with you. Please tune in next week when we are going to talk about sleep. Cheers. Bye.